I chose my lab specifically because it's a microfluidics lab. Microfluidics is such a low-cost field that it's something that you can really apply to different areas. I work with a lot of sickle cell patients, and Houston just has a very, very large sickle cell patient population. So we ask ourselves the question, well, why aren't there that many therapeutic options? So unfortunately, sickle cell disease is under-resourced. Our lab actually started with paper-based diagnostics. We would ship those actually to tertiary hospitals in Africa. In those instances, the mothers typically didn't know they had sickle cell disease, so they wouldn't know whether or not they passed it on to their child. That's initially how we started, and then we were kind of like, well, that's really amazing, that's really great work, and we're very proud of it, but we also wanted to take it back to here in Houston. We had amazing collaborators at the Texas Children's Hospital here in Houston. They are essentially studying whether or not novel therapeutic options will actually work for these patients, as well as what other symptoms should we really be looking for. And so that's kind of where our microfluidic device fits in. It's this artificial microvascular network where we can essentially see whether or not small, very minute changes in the RBC shape or the red blood cell shape affects the blood flow of a patient. And a lot of the symptoms from sickle cell disease are derived from this irregular blood flow. So if we can detect that within our own microfluidic device really rapidly and at low cost, then we can potentially use it to study sickle cell patients on novel treatment options. And we can also be using it to just study in general whether or not curative options for sickle cell disease are actually working.